Hello, and welcome to this morning's Momentum discussion. These sessions are designed to stimulate dialogue on trends that exhibit significant momentum to advance the field of gerontology. Today's discussion will center around a newly released report from GSA and the Bank of America entitled The Impact of Diversity on Longevity Fitness, a Life Course Perspective. Our discussion today will be anchored by 4 panelists, each of whom served on the work group that helped produce the report. We each bring different perspectives to the question of longevity fitness. My name is Richard Johnson. I chaired the work group, and I'm a senior fellow and director of the program on retirement policy at the Urban Institute in Washington, D.C. I'm an economist who specializes in financial security at older ages. Maricruz Rivera-Hernandez is an assistant professor of health services, policy, and practice at Brown University. A member of our work group, she is a gerontologist and health services researcher who focuses on health and healthcare disparities among older, vulnerable adults. Diane, another member of the work group, is a senior partner at Business for Impact and the interim director of the Aging Well Hub, both at the McDonough School of Business at Georgetown University. She's an expert in marketing and business strategy and has a long history of product, service, and program innovation in the nonprofit, corporate, and public sectors. Finally, Kai Walker is head of inclusion transformation at Bank of America. He has 30 years of experience in retirement and financial services. We have a downloadable handout that includes panelist bios, a link to the report, and other resources that you can access if you wish. This session will last about 60 minutes. We're each going to speak for about 8 minutes, and that should leave about 20 minutes for discussion. You can use the chat function on the right of your screen to pose your questions to the panel. And before we begin, I'd like to thank Bank of America for their generous financial support of this project. So without further delay, let's start the session. So one of the great achievements of humankind, particularly over the past century, has been the dramatic increase in life expectancy. Because of breakthroughs in medical technology and public health measures, people are living longer than ever. In the first part of the 20th century, those gains focused on reducing infant mortality. And since about the middle of the past century, we've seen significant gains in life expectancy at older ages. The expansion of lifespans also poses important challenges. How can we ensure that people make the most of those additional years? What kind of public policies and private practices can we put in place to help people be financially secure, physically robust, cognitively intact, and emotionally strong throughout the life course? Now, over the past 3 years, GSA and Bank of America have explored the increasingly long lifespans enjoyed by Americans through the lens of longevity fitness. In 2018, the report Longevity Economics addressed the problems of systematic ageism and age discrimination, and the need for policies and programs that recognize the reality of people living far past the historical retirement age of 65. It emphasized that older adults are working and making productive contributions to society longer than ever before. A second report, Longevity Fitness, was released in 2019, and it detailed how people can thrive, not just survive, throughout longer lifespans by making changes in their lives aimed at maximizing social, health, and wealth equity. Longevity Fitness emphasizes multiple facets of fitness, including financial security, physical and cognitive health, and emotional well-being. Now, this year's publication is the third report in the Longevity Fitness series, and it emphasizes the diversity within our nation. Many Americans face intractable equities based on the color of their skin, where they live, their gender, and who they live. The report documents the effects of these inequities and explores the beneficial efforts of corporations and other employers to enhance diversity and inclusion. One-size-fits-all solutions to promote longevity fitness aren't going to help all groups. And to have maximum impact, we need to tailor our approach to meet the special needs of each particular group. Now, this report was planned a long time before the start of 2020, but the events this year have shown a spotlight on the dramatic disparities that exist in our society, and they underscore the importance of viewing well-being through a diversity lens. The COVID-19 pandemic has created health and economic crises for many Americans, but the consequences vary across different regions of the country. They differ by gender, and they've been especially severe for people of color. Then the killing this year of George Floyd, of Breonna Taylor, and of other Black people have laid bare the real challenges we face in creating a just society for all, and the real challenges that Black people and others face in maintaining any sense of personal security. Those episodes of police brutality have really accelerated the racial equity movement. These inequities, factors that go beyond what people can change single-handedly, must be addressed by attention to diversity, inclusion, and ultimately equality on the part of corporations and other employers, on the part of government, on the part of the entire society. And so I don't think this report could be more timely. As in the previous reports, we take a life course perspective in this study. So at each stage of life, at young ages, at middle ages, at older ages, people need to take certain steps and achieve certain milestones to maintain longevity fitness. It starts with education and obtaining a good job, then building wealth through home ownership and investing in retirement accounts, starting a family perhaps, maintaining meaningful social relationships, staying active and engaged, eating healthy, obtaining quality health care. How well you do in old age really depends on everything that came before. And in this report, we take a broad view of diversity. First, we recognize that place really matters. Opportunities vary dramatically based on where you live, your access to a good school and to quality health care, your ability to obtain a well-paying, meaningful job, your access to affordable housing, your home buying options that allow you to build wealth, your access to healthy food options, your ability to live in an environment that's free of toxic chemicals and free of violent crime. All that depends on where you live. Opportunities are so very different for people who live in rural areas, people who live in depressed inner cities on Indian reservations, than let's say for people living in thriving metropolitan areas. And within those metro areas, we see sharp divides across neighborhoods. Second, race matters. Our nation's legacy of slavery, segregation, and racial discrimination, plus ongoing systemic racism, limit Black people's ability to obtain a good education, to get a well-paying job, to build wealth, and obtain high-quality healthcare. Decades after the start of the Civil Rights Movement, Blacks still earn much less than whites. They're less likely to own their own home. They have only a tiny fraction of the wealth accumulated by whites. Health outcomes are much worse for Blacks and for whites, with Blacks experiencing higher rates of most chronic diseases than whites. Hispanics and Asian Americans also face discrimination that can limit their longevity fitness. Third, gender matters. Women earn less than men, despite the fact that they're now more likely than men to obtain a college degree. They accumulate less wealth in retirement accounts. And one special challenge that they face is that they spend more time as caregivers, which limits their ability to work and to save. And they live longer on average than men, which means that they're more likely to be widowed in old age, and that limits their access to family care in old age. And as a result, many older women need expensive paid long-term services and supports if they develop disabilities. And that drains their financial resources, makes them less financially fit, makes them less longevity fit. Finally, sexual orientation and gender identity matter. Many LGBTQ people face rejection from families and friends, more likely to experience substance abuse and homelessness, more likely to have mental health problems, more likely to attempt suicide, have problems accessing mental health services. In old age, this can be particularly problematic for older people who don't have children in the LGBT community, because they lack, again, like some divorced widowed women, maybe lack access to family caregivers. Now, the pandemic has really challenged people to seek and maintain their health, their wealth, and certainly their social connections. And from the chaos created by the pandemic, changes will emerge in the ways that people work and shop, the jobs that they do, and ultimately the skills that they need. So one of the changes we're seeing is that more people are working from home, but not everyone can work from home. And so that's an important divide that we see. The winners are the people who work from home. Those people who have better homes, who have places in their homes where they can isolate to get their work done and not be distracted by other things going on at home. They have quality internet connections. They have neighborhoods with stores that are stocked with healthy foods, with safe and walkable streets, with good medical care, with parks where children can play and adults can exercise. But again, not everyone has these advantages, and that creates important disparities that the ongoing pandemic is really highlighting. And technology is becoming more important than ever, and everyone must use it to their advantage. So again, the winners, the people who are doing well with this change created by the pandemic, are those with better computers and other devices, those with better computer skills, those with the inclination to fill in any knowledge gaps that they have. So that's why I think as we're thinking about this important issue, thinking how the ongoing pandemic is going to affect that is particularly important. Stepping back, a big part of longevity fitness is wealth building, and home ownership is a major source of wealth for most Americans. But again, there's variations across the country and across different types of people in the ability to own a home. So homes in cities often cost more than residents can afford. And that's especially true for many people of color. So in major metropolitan areas across the country, but especially on the coasts, the majority of people who rent cannot afford to buy homes, and those who own homes are disproportionately white. Many metropolitan areas see huge gaps in racial gaps in home ownership. That gap is largest in Minneapolis, where the gap is 51%. 76% of whites own their homes, compared with only 25% of blacks. But that gap exists throughout the country. And when people rent, they're often burdened by housing costs, and that makes it more difficult for them to meet healthcare needs and to meet the other kinds of needs that they face. It makes it particularly difficult to save for retirement if so much of your money is going to rent. Renters spend a disproportionate amount of their income on housing costs, and as I said, that can create real challenges. And finally, I just want to wrap up by saying that there are a lot of steps that the private sector, in combination with the public sectors and with nonprofit organizations, are taking to integrate diversity and inclusion mindset into employment practices and research programs and practice. I think a good example is the P-TECH program, which fills new-collar jobs that pay well but don't require university-level education. Particularly in the STEM sector, traditional college majors don't equip students with the necessary knowledge and skills. And associate degrees in STEM areas are often more targeted at developing marketable skills at lower cost to the student. So P-TECH is a public-private partnership between IBM, the New York City Department of Education, and the City University of New York. And it was launched in 2011 to provide people with associate degrees with the STEM skills that they need to get good jobs. And it's now expanded into 8 states. So I think what's encouraging, and as we outline in the report, there are a lot of important best practices that are going on, and hopefully this report will promote those kinds of practices so that we can see longevity fitness be more achievable for people across the country and across all the different diverse groups that make up our country. And with that, I'd like to turn to Maricruz, who's going to talk to us more about race and place.
Hello, everyone. It's a pleasure to be part of this panel and this report regarding longevity fitness. As mentioned by Richard, the objective of the report is to explain some of the complex interactions of environmental, sociocultural, behavioral, and biological factors on disparities using the National Institute on Aging Health Disparities Research Framework. So some of the points that Richard mentioned might come across again because this report, these factors are examined through the lenses of where people live, the color of their skin, their gender, and who they love. Based on this, I'm going to provide a brief summary of how place and race and ethnicity matters and how these two factors relate to each other and the impact that they might have in creating inequities in communities of color. People have moved to cities. Housing, food, transportation, and other costs are higher in cities than they are for the minority of people living in rural areas or small towns. Rural areas are incredibly diverse, yet often not inclusive. Limited communities are available to provide social support, and healthcare professionals can lack both expertise and empathy for addressing their physical and psychological needs. One thing that has been obvious from the beginning of the COVID-19 pandemic is that educational opportunities vary greatly, even in urban areas, depending on one's zip code. Some children receive iPads or computers to access online education, while others did not have access to these resources. The chronic neglect of the long-term care system is exposed by the predominance of deaths among residents in assisted living facilities and nursing homes, in which facilities with a higher proportion of minority residents often provide lower quality of care compared to facilities with a high proportion of white residents. We are seeing higher COVID-19 related deaths in facilities with a high proportion of minority residents. The inability to generate wealth and pass it into the next generation has limited opportunities for many people of color. Richard mentioned that median annual earnings are disproportionately higher for white men, and whites hold a large majority of real estate in the United States. Houses costs in cities, towns, and different parts of the United States differ greatly, and patterns of home ownership also vary among races and ethnicity, especially among African Americans and Hispanics. Given the long-standing and ongoing segregation of many American neighborhoods, the place-based considerations for longevity fitness can carry over the social, health, and wealth challenges faced by people of color. But the obstacles that push people down and keep them from thriving are not all explained by place. Race and systematic racism built into the economic, educational, and healthcare structures have an impact on people's life. The cascade of inequalities faced by people of color may have been highlighted by the COVID-19 pandemic, but they are not new. The social determinants of health and the racial equality movement have shown how systematic racism created and sustains inequality of opportunity and justice. To illustrate this, as Richard mentioned, when a pandemic closes offices and retail businesses, those who can work from home, like many of us, are in a neighborhood with good internet connection and keep making money, and those who don't have those advantages need to figure out how to live in a one-time federal stimulus check and with limited unemployment benefits. Today, many Hispanic immigrants are paying minimum wages without health benefits during a pandemic that has had devastating effects for their families and communities. In fact, the fact that people of color are more often living in areas with limited resources, with educational opportunities, is not by chance, and it is a direct outcome of decisions made long ago and investments made or not made in infrastructure and educational opportunities. However, when we talk about disparities, we may often think about minority groups as a one heterogeneous group. In terms of financial security, Asians are held up as the model minority. For instance, Asian Americans in the highest quintile earn income that are nearly 11 times higher than those in the lowest quintile. And this gap is continuing to increase. The myth of Asians as a successful minority obfuscates the problem of those in lower income categories. This demonstrates the importance of disaggregating data that might reveal heterogeneity in access to resources. Unless the root causes of systematic and long-standing racism are addressed, adverse outcomes in the behavioral realm will continue complicating and compromising longevity fitness for people of color. This report identifies best practices, as Richard mentioned, for integrating a diversity and inclusion mindset into employment practices. For example, companies must remember that diversity does not work without inclusion and ultimately equity and equality. Diversity and inclusion programs in American corporations and society can help address this systemic racism, which permeates all aspects of life and affects Blacks and other people of color and those of different genders, sexuality, sexual identities, and economic backgrounds. Evidence-based approaches for improving diversity and inclusion will include collecting and comparing diversity data over time, having alternative complaint systems to address the problem of retaliation following discrimination or harassment complaints, texting for bias technology in hiring and evaluation systems, being sure not to ignore groups that are seriously underrepresented in the workplace. For example, several universities right now are conducting cluster hires to promote diversity and inclusion, and involving managers from the start to address companies' unique logistic, culture, and dynamics. In summary, companies can begin this process by providing full benefits to all employees, including options for healthcare and retirement savings, and use employee assistance programs to help those facing difficulties, and find ways of communicating needs to managers and corporate leaders. I will be happy to continue this conversation, and now next, Diane will talk about obesity and nutrition.
Thank you. It's a privilege to be involved with this important report as we examine how all the important factors related to diversity contribute to longevity fitness. I'll be discussing the racial differences in chronic disease with a focus on the prevalence of obesity and how gender, race, ethnicity, and socioeconomic status are factors in this complex disease. In addition to leading the Aging Well Hub at Georgetown Business for Impact, I currently lead a multi-sector coalition involving food and beverage manufacturers, nonprofits, whether they be in public health, community-based organizations, advocacy, also academics and government agency representatives, who've all come together under the umbrella of portion balance as one solution to address the obesity epidemic. And there is no silver bullet, it's just one approach. When I started this work nearly 2 years ago, my writings, proposals, I would cite the prevalence of obesity as being nearly 40%. As of September of this year, I'm now saying it's over 40%, 42.4% to be exact. And among children ages 2 to 19, I used to cite 18.5% over the last couple of years. And again, as of September, it's now 19.3%. So clearly, this is moving in the wrong direction. And when you factor in individuals who are overweight, we're looking at well over 70% of Americans with obesity are overweight. And so consistent with what my fellow panelists have already discussed, underneath the high rates of obesity are race-related differences. While race-related differences can also be demonstrated in areas such as smoking, violence, alcohol and substance use, and physical activity, these are more closely related to psychosocial stress, which is secondary to socioeconomic status, income and wealth, and inequalities in housing, nutrition, and healthcare. Unhealthy lifestyles and habits are contributors to obesity. People living in certain areas of the US with high rates of obesity are more likely to be physically inactive, and very few eat the recommended daily servings of fruits and vegetables. If consumption of fruits and vegetables is a good proxy for a healthy diet, then we really need to examine this and the topic of nutrition more closely. If we start with the old adage, you are what you eat, this is so true as we look at the impact of nutrition on human health, beginning in utero and continuing through life. In our definition of portion balance, we take into account 3 factors: volume or size, proportionality, variety, and quality in our food and beverage choices. Quality in our portion balance definition is about nutrient density or nutrient-rich foods. And unfortunately, the availability and affordability of healthy or nutritious foods varies greatly by zip code. It's actually shocking to see the dual conditions of obesity and malnutrition disproportionately impacting families living in poverty. According to a recent USDA study, nearly 30 million Americans live in communities underserved by supermarkets or other healthy food retail. This problem impacts residents of urban and rural areas alike, and especially those living in lower income and minority communities. People without convenient access to supermarkets suffer from disproportionately high rates of obesity, diabetes, and other diet-related disease. So this lack of reliable access to nutritious, healthy, affordable foods, combined with a lack of information on how to make healthier decisions, is a major contributor to obesity. And if anything, the pandemic has certainly magnified the risks of a poor diet. We're seeing more severe outcomes in people with obesity and other chronic conditions due to COVID-19 infection. There are marked differences in obesity rates among people of different races. This starts early and it continues into adulthood, with Blacks, Hispanics, and Native Americans at significantly higher levels than Asians and whites. There are also marked differences, meaning much higher rates of COVID-19 hospitalizations for Blacks, Hispanics, and Native Americans. I have these numbers from the CDC, which reflect these higher rates. Blacks, who have 49% prevalence for obesity, are hospitalized 4.7 times more than whites. Hispanics, who are 44.8% with obesity, are being hospitalized at 4.6% more than whites. And Native Americans, who are 48.1% with obesity, are being hospitalized at 5.3 times the rate of whites. We're also seeing racial differences in cognition with dementia, particularly Alzheimer's disease, disproportionately impacting communities of color and women. And I bring this up because there's a growing amount of research concluding that Alzheimer's and other dementias are linked to a poor diet. Not only are women at a higher risk for Alzheimer's, they're also disproportionately serving as unpaid family caregivers to their loved ones, whether it's an aging parent or spouse. They're juggling their caregiver duties in addition to work, caring for their own children, and compromising their own health and, of course, their finances. Also, without good jobs, minorities often don't have and can't afford health insurance. This affects their health in the long run, but has been especially detrimental during the pandemic. Essential workers need to keep working, often have to work outside the home where coronavirus exposure is greater, and do not have insurance or sick leave if symptoms develop. It's really important to integrate a diversity and inclusion mindset into employment practices, research programs, and practice. The workplace is a prime place for interventions designed to increase healthy behaviors among adults. Something to keep in mind, though, is when developing health and fitness programs for employees, companies should be aware that some people who have obesity or are overweight are satisfied with their body size. We look at benefits identified by the Society for Human Resource Management as encouraging healthy behaviors, including vaccination clinics, nutrition education, exercise clinics, fitness centers and fitness club memberships, health screenings, health risk assessments, weight loss programs, smoking cessation programs, stress reduction programs, and health and wellness incentives. And I think this is a good way to transition to Kai Walker from Bank of America, who will talk about the importance of workplace benefits.
Great, and thank you, Diane. And I'd also like to thank the GSA for their continued partnership and for taking the lead in conducting this important study. We're frequently asked why Bank of America is interested in topics such as this, and why would a financial services firm be interested in research related to longevity and diversity? The short answer is that it's important to us because it's important to our clients. As the study highlights, lifespans are increasing, however, times are changing, and longevity gains for some are under threat. As a provider of retirement services, we interact with millions of clients across the country that routinely share their concerns, whether they be individuals, companies, or employees of companies. These same concerns are also top of mind for our 200,000 plus teammates and the communities that we serve as they also attempt to navigate these challenges. The concerns expressed are wide-ranging and often centered in the arena of financial wellness. How do I pay down student or credit card debt? Create an emergency savings fund? Navigate ever-rising healthcare costs? Perhaps it's managing caregiving responsibilities and the like. And while expressed in terms of financial wellness, these concerns often impact emotional, mental, and physical wellness as well. Additionally, these concerns have been amplified over the last several months and have impacted demographic segments of the population in very different ways. Whether examining the effects by gender, age, or ethnicity, one's sense of well-being has certainly been challenged. We also see this dynamic playing out in the research study that we published, the 10th annual edition of our Workplace Benefits Report. Through an independent nationwide survey of employees and employers, the report examines trends in the workplace, their financial life benefits, and wellness programs tracking both employee and employer sentiment. The good news is that 62% of employers today feel extremely responsible for their employees' financial wellness, compared to 13% in 2013. The sense of increased responsibility by employers is even greater with respect to their employees' retirement savings, with 80% feeling very or extremely responsible for helping employees prepare for retirement, healthcare needs, and costs. And those are up 22% since 2012. Additionally, we find the range of topics being addressed by these programs has increased dramatically since 2013, with employees seeking support across a variety of financial dimensions, including saving for retirement, planning for healthcare costs, budgeting, saving for college, and managing debt. And while this growth is encouraging, the pandemic has brought the topic of holistic well-being into sharper focus. Though the effects of these times have yet to be fully understood, employees are facing greater stress and demands on their time, straining their overall sense of wellness. More needs to be done to ensure employees feel supported at work, financially, physically, emotionally, and mentally. I'd like to highlight a few observations from the report. First, employee wellness and finances are very well established to be interconnected. 57% of employees feel their productivity is impacted by their sense of well-being. When asked what factors contribute to their sense of well-being, employees cited mental wellness at 54% and physical wellness at 51%, and only slightly more so than financial wellness at 49%. Secondly, financial wellness has declined since 2018, and we find that varies by generation. In March of this year, 49% of employees rated their financial wellness as good or excellent, and that is down from 55% in 2019 and down 61% since 2018. Fewer Gen Zs, Millennials, and Gen Xers rate their financial wellness as good or excellent today. Thirdly, the top obstacle cited for not achieving their goals is the lack of disposable income after monthly expenses. Fewer than 4 in 10 employees say they have made significant progress towards specific personal financial goals. Employees ranked advice from a financial professional as a top employer-offered resource with whom they want to discuss a range of topics and have the flexibility in terms of how they access advice. Next, we found that debt is a multifaceted challenge that spans the generations. 82% of employees have some type of debt, with the most common being credit card debt, mortgage debt, and student loan debt. And debt can erode at the sense of financial well-being. 59% of employees say they do not have enough control over their debt, and 36% say it affects their ability to achieve their financial goals. And then we also looked at the notion of women in financial wellness. And the report found that 41% of women rate their financial wellness as good or excellent, and that is compared to 58% of men who rate their wellness as good or excellent. This, combined with the fact that women often make less than their male counterparts, are more likely to take time out of the workforce to raise children or provide care for a family member, and typically live longer. Regarding debt, women are likely to have more credit card debt, 56% versus 43% of men, student loan debt, 30% versus 11% for men, and are more likely to feel the lack of control over their debt, 67% versus 49% for men. Women are also more likely to rank paying off credit card debt amongst their top priorities, and women are nearly twice as likely to say the lack of cash after monthly expenses as a primary challenge to achieve their financial wellness. Another dimension we examined in our research is the prevalence of diversity and inclusion programs as an important component in promoting employee wellness. At Bank of America, we believe that our diversity makes us stronger and is essential to our ability to serve our clients. We also believe that inclusivity can contribute to overall feelings of well-being amongst employees. The good news is that more and more employers agree. Employers are taking steps to formalize their D&I programs and see value in promoting diversity and inclusion as something that is important for talent management, corporate culture, and even keeping up with the competition. What we found across the spectrum of company sizes, a relatively consistent proportion of employers indicated that they have a D&I program in place. However, when asked if employees were aware of the program, smaller companies lagged their larger counterparts. Employers that want to promote overall wellness should not only be putting these programs in place, they should also take the steps to proactively promote them to their employees. And smaller companies should make the efforts to close the awareness gap. At Bank of America, we know that supporting the physical, financial, and emotional wellness of our employees in their personal lives supports them in their work life so they can be the best at work and at home. And when it comes to financial wellness, we believe that more informed people are about their money, the clearer their financial outlook can be, and the greater sense of well-being they can achieve. Thank you.
And you're live.
Thank you, everyone, for listening, and I'd like to thank the panelists for their thought-provoking presentations. Now we'd like to move into our live question and answer session, and we look forward to receiving your questions and having you participate in this important discussion. I'll kick off the conversation with a few questions of my own. I think one of the things that we've seen during the coronavirus is that it's really highlighted the shortcomings of our current system of long-term services and supports. And for example, we've seen enormously high death tolls among nursing home residents. And so if I could start with you, Maricruz Rivera-Hernandez, could you talk a little bit about how COVID-19 is impacting facilities with a higher proportion of minority residents?
Yes, thank you, Richard. Based on my research, current results from different studies are consistent with studies conducted pre-COVID-19 that have highlighted a long history of racial disparities in quality of care and health outcomes in nursing home settings. COVID-19 has presented new challenges for nursing homes, especially nursing homes that take care of a high proportion of minority residents, which are often financed by Medicaid. For instance, facilities were never expected or required to stock the type of quantity of personal protective equipment like masks or other PPE to protect healthcare workers during the pandemic. It appears that the impact is higher among these facilities with a high proportion of minorities. Overall, current events have highlighted this long history of structural racism, and these findings just reflect the systemic and racial disparity prevalent in our communities across the U.S.
I wonder if you think that we're going to have long-term impacts on nursing homes and how we care for older people with disabilities. Do we think that what we've seen during the COVID-19 pandemic is going to make people more leery to go into nursing homes, and that perhaps we'll see that there'll be more demand for home care, though I guess home care also has challenges and creates risks because you're bringing someone into your home who may be infected, maybe asymptomatic, but there are also risks there. I just sort of wonder if we're going to see some long-term impacts of COVID-19 on nursing home facilities and the way we care for older people.
Yeah, and experts have written a lot of journal articles suggesting, that there are going to be long impacts in how we care for older adults and the long-term care system overall. And one of the things is that right now the shifts have been that minorities tend to go to nursing homes at a higher proportion than other groups that have access for assisted living. For example, white folks have better access to a higher quality of assisted living facilities or higher quality of nursing homes overall. And now we've seen that while in the past, minorities used to be at home for longer and families were expected to take care of them. Now there's a shift that, minorities want to work and want to go to the labor force. And now their adults, have to be taken care of by someone. So they are going to these nursing home facilities. So we definitely have to rethink how we provide better access for everyone, that will need long-term care in the future.
Yeah, I think one of the things that COVID-19 has really highlighted is just these disparities in society and how it's people of color, people with limited economic resources who are being hit hardest. That's usually the case when there's a natural disaster, that it always hits people at the bottom portions of the economic strata harder. But one of the things we've also seen during the pandemic is that now more people can work anywhere they want, assuming they have the technology, they have the flexibility, they don't have a frontline job. But we're seeing more people, being able to work remotely and then maybe moving and living in new places. And how do we think that trend might shift longevity fitness for Americans? The fact that perhaps people will not have to live in densely populated metropolitan areas to still do their job in those areas.
Is that a question for me?
For anyone who cares to weigh in. I think when I think about this, I'm sort of thinking that, well, it could be, I think part of it depends where people are moving to. I think that flexibility is probably pretty good, right? That it does, and then we think about, well, if moving to areas with lower housing costs, then that means that maybe their dollars can go further, and so that maybe we're seeing, that can improve longevity fitness if it gives people a better opportunity to save for retirement, for example. But then if you go into more rural areas, does that create other kinds of challenges that in terms of access to healthcare, perhaps, or access to long-term services and supports that might be a little bit more sparse in those areas. But then you can also think, well, maybe this is going to sort of level the playing field between urban and rural areas more if we're getting well-educated people moving into rural areas where the educational level on average tends to be a little bit lower.
Yeah, it would be very interesting to see what those migration patterns, post-COVID show. But for example, like in the case of folks living in Boston, I can see them moving to areas that are still here in Massachusetts, but more like central Mass, that they will still have access to a lot of healthcare infrastructure and resources like that, but they are not living, in the Metro Boston area just per se. But it would be very interesting to see if a lot of folks are actually moving to rural communities in the Midwest part of the US.
Right, so maybe moving to smaller metropolitan areas from big mega cities, but not moving into rural areas as much. So still having those, but also moving into areas where probably housing costs are lower, and that could certainly help their ability to save for retirement, for example. Just sort of one last question on COVID-19 before we move on to other topics. One of the, there's been so much about all the obvious challenges and catastrophe that COVID-19 has been, and we certainly don't want to, understate the incredible amount of pain people have suffered. But is there something, the changes that we've seen in response to COVID-19, is there anything positive that might lead to? Any changes that we've seen that could actually improve longevity fitness perhaps in the future? I mean, we sort of alluded to maybe this possibility of moving to less expensive areas might help. Are there other things that might have lasting impact?
Here. I'll take that, Richard. I think what we're seeing, a big part of longevity fitness is social, in addition to health and wealth. And what we're seeing are trends around more local connections. Really caring about your small businesses in the local community, neighbors connecting more. And showing more caring for that local community. So perhaps we'll see more connection and caring for our older adults, the intergenerational piece as well. But so much is changing rapidly. It'll remains to be seen, but I'm hopeful that might be a positive outcome of the pandemic.
And Rich,
Yeah, I mean,
I
that's
would also,
interesting because we focus so much on social isolation, and yet you're saying that maybe the pandemic could actually lead to more social integration.
Perhaps.
And yeah, I think also to the extent that we're seeing more remote work, I mean, I think that could certainly help. One of the challenges I think COVID-19 has created is what does it mean for older workers and their ability to remain engaged, remain productive, to keep working. We know that's so important for retirement income security, for longevity fitness. And in fact, we had one of our the first report in this series was all about working longer and how important that is. What an important part of longevity fitness, the ability to work longer, is. There's this concern that, well, if it's risky health-wise for some older folks to go to work, are we going to see perhaps less employment at older ages? But on the other hand, for at least for some group of employees, the extent that they can work at home could actually allow them to even work longer. And I think we're seeing employers becoming more familiar with the technology that allows people to work from home and to stay active at older ages. So that's potentially encouraging. I think the downside, though, is that again, we're seeing this continuous stratification in the labor market, that there are those people who are doing well, and in this kind of recovery, right, that during the pandemic, we've seen that different types of workers are being hit harder than others. And certainly to the extent that people who can work from home, maybe not being affected much, people who working in frontline jobs, often that pay less, they're the ones who are losing their jobs, who can't continue working. And so I think that is a challenge. I think on average, I would say that, the negatives of COVID-19 certainly far outweigh any positive developments, but maybe there's a little glimmer that what doesn't kill us makes us stronger, perhaps, but that we're also seeing this some resilience in society, maybe, and maybe that's encouraging, and we can take some hope from that. Well, let me shift to some other questions that have come in. Diane, you mentioned the Portion Balance Coalition. And that really kind of focuses on these portion control issues. How did you decide to focus on portions?
So Richard, there really are a lot of different factors that contribute to the current food environment that promotes overconsumption, kind of the wrong things, and poor nutrition. And a big contributor of that is portions, oversized portions, or what we call portion distortion. McKinsey did a study in 2014, huge global study called Overcoming Obesity. And they looked at 74 different interventions to address the obesity crisis. Number one on that list was portion control. There's no silver bullet. That alone isn't going to do it. It's such a multifactorial, complex disease. But we decided portion control would be a focus for us. It was the galvanizing theme that brought us together, but we were very intentional in changing that to portion balance. I think control sort of implies limiting, making it smaller. And by making it about portion balance, we factored into three things in our definition: the volume, obviously that gets at the size, but the proportionality as well as quality. And that bigger definition allowed us to have a big tent, and something as complex as obesity needs multi-sector folks at the table. And I did think of one more thing that we're seeing kind of as a positive. It's going to be long-term, but there's more cooking at home, which tends to mean you're cooking eating healthier. You're more aware of what you're putting into your meals. And there's just been such a huge focus on our food systems. And we've known there's a hunger issue in this country. It's been rather hidden, but we're seeing nearly 30% of Americans now who are food insecure. We've seen over almost 7 million new enrollees on SNAP or food stamps during this time. So it's going to highlight and bring a lot of attention to our broken food system for folks who are lower income.
Yeah, I think that's a really important point about eating at home and how, I think with the Affordable Care Act, which required more information on menus about calories and nutrition information when you're eating out. There's just in general, I think, been much more attention to that eating out is often not that healthy, and the ability, people's, I mean, now it's almost a requirement, or it's much harder, much more hard now to eat outside than it used to be. But also, I think just giving people more encouragement, more opportunity to eat at home could certainly help people's health and hence their long-term, their longevity fitness.
Hey, Rich, if you can hear me, I'd like to weigh in as well.
Please, thank you.
Sure, yes. So as it pertains to that last question, and I thought Diane's response was spot on, but as I think about the workplace, many companies right now are either concluding or in the midst of their open enrollment season. And I think the pandemic has really placed an emphasis on the healthcare component of that open enrollment. And for many companies, ours included, there are incentives for health screenings. There's education around healthy eating habits and the like. And I think those have just come into sharper focus in terms of tending to one's personal care. And then lastly, I think one of the things that is also being emphasized, both associated with the pandemic, but also in workplace culture, is the need to get a flu shot. And so we're seeing a rise in that as well.
Right. No, that's yeah. I guess I don't know exactly what the normal take-up rate is for flu shots, but it's never been 100%. It's always been lower than it should be. And you know, I mean, I think there used to be this sense that, well, if you're 65 and older, maybe you need one. Maybe not so important if you're younger. And now certainly the evidence has shifted. And in recent years, and now with the pandemic, of course, even that much more important to get the flu shot. So it's interesting how just this focus on health, you know, might just lead to better health practices. Of course, there's also seeing that people maybe being a little afraid to go and get some regular health screenings and cancer screenings and other things that sort of goes in the other way. So we'll sort of see how all this this plays out. But I think the focus on a flu shot is really interesting. You know, Kai, while we're talking to you, and this is Kai Walker, for those of you who maybe weren't here for the beginning of the conversation. Could you tell us a little more about what companies are doing to improve diversity and inclusion, and maybe perhaps Bank of America, but not necessarily just Bank of America?
Sure. Yeah. So broadly, many companies are embracing the notion of diversity and inclusion. One, I think, in part because it's the right thing to do, but also there are studies that show that it actually contributes to the bottom line. So there's a return on investment for these programs in terms of the ability to reach new and diverse markets, and again, to contribute to overall profitability. In terms of the breadth of the programs, I think there's a couple of things to focus on. One is not only the diversity component, it's great to have a diverse population of employees. It's another thing to be inclusive in terms of the utilization of those employees and making them feel that they are part of the team. And I think that's really where the richness of having a diverse population comes into play. And so what we're seeing is more adoption of these programs, more adoption of employee resource groups to help inform the company as to the nature of the programs and the form and shape they should take. And then lastly, one of the things that we're seeing that's highlighted in some of our research is, it's typical that larger companies take the lead and smaller companies follow. And we're actually seeing that even within smaller companies, that a D&I program is taking shape and form even in those smaller companies.
And there's some examples in the report that is really kind of anchors our discussion today. Some examples there of some best practices and what employers have been doing recently to promote inclusion in the workplace. So also when I'm thinking about this, there's the private side. There's what can employers do, and there's also what can governments do. What kind of policies should we be thinking about to promote longevity fitness for everyone, for not just one part of society, but for all groups. Any thoughts about some some public policies that we might want to think about. And let me emphasize, and we talk about diversity here. We're talking about the broad range of diversity. We're talking about people of color, people of all colors. We're talking about people, talking about differences by gender, sexual orientation, and gender identity, differences by place. So any sort of policy ideas that we might want to think about? Well, one of the so when I've been thinking about some of these issues, what we really want to do is think about promoting, that, as I was in my opening remarks, that how people do at the end of life really depends on what happens throughout. And so I think one of the challenges people face is wealth building. What can we do to promote wealth building for all people throughout the life course? And I think there are some important employer actions that we could think about. But there are ways that policy can promote wealth building in employer retirement plans, for example. So one of the proposals, the way now that we incentivize retirement savings is we offer employees a tax deduction, and that gives people in high tax brackets a big break and doesn't affect people who don't pay any federal income tax, which is not an insignificant part of the population. They pay other taxes, but not federal income taxes. And so if we move to a federal income tax credit or refundable credit, for example, to change those incentives, to provide more incentives for people of lower economic status to save for retirement, I think that's something that could help. Again, there's more attention to automatic enrollment in employer plans, and maybe requiring automatic enrollment, and that's something that people in Washington have been talking about. Auto escalation, so that once you enroll in your 401k plan, you're not stuck at this initial low level, but every year as you get a raise, more money goes into, a greater percentage of your salary goes into the 401k plan to help you build. And then I think home ownership, and there's still so much barriers that people face in terms of owning a home, and how important that is to retirement savings, to accumulating wealth over time, and how your home is often your biggest source of wealth for most people at older ages. And so to just ensure that we eliminate the sort of racial barriers that still exist in the home ownership market to this type of maybe more coaching. I just think there's a lot we can do to promote home ownership.
And Rich, from a retirement wealth building standpoint, I think one of the things that has been discussed is the fact that only half of Americans are covered by an employer's retirement plan, a 401k plan, let's say, and the other half, largely small businesses, do not provide or do not have access to those plans. And so broadening access to retirement savings, I think, would be a good policy prescription. There's a number of things out there that seem to attempt to get at this, and we'll have to see what plays out in 2021 in terms of them taking shape and ultimate form.
Yeah, no, I think that's such an important point. Right, people can't save in their employer retirement account unless they have one. And we have seen a lot of states promoting or pursuing state retirement plans where that they would require an employer to offer the option of payroll deductions that would then be deposited into an IRA, for example. And what we always see is just how important inertia is, how the just having these automatic deductions, you don't have to think about it, just comes out of your paycheck, you don't see it, and how important that is to wealth building. So I think that's, and we'll see if we're going to get any access. Right now, we've only seen it at the state level, and it's complicated for people who move across from one state to another, and but maybe thinking about a national program. There has been talking Congress about that, hasn't come to fruition yet. That just about brings us to the end of our discussion. Unless the panelists have any final comments they want to make in the remaining 60 seconds or so we have left. Then I will take this time to thank you for your time and insights. I want to thank all the participants who are listening for their contributions. I'd like to thank the Bank of America for its financial support of the report that has anchored our conversation. And I think what I take away from this is just, as we've been saying, that our nation's diversity is really one of our great strengths. We still have work to do to guarantee that all groups can achieve longevity fitness. And I really hope this report and discussion can jumpstart efforts to really make that happen. So thank you all again.